She has seen the death and suffering firsthand. And tonight, an international expert on Ebola is in the tri-state sharing her knowledge with us. An Ebola patient in Dallas died recently, and now a nurse is being treated. So how concerned should we be? Jackie Congedo addressing that question tonight. Jackie?
Mike, as precautions are underway here in the tri-state, we sat down with a woman who is very familiar with the worst-case scenario.
It's kind of the perfect medical storm.
It's the term Dr. Dean Marchbein uses to describe the Ebola virus's hold on West Africa. And she would know. She's president of Doctors Without Borders USA, an organization providing aid in 3 affected African countries.
We have an illness where there were 300 cases in March, where there were more than 6,000 cases in September. And the World Health Organization is estimating that if nothing is done by February, there will be 1.4 million cases.
Those projections, coupled with a few infected Americans, are leading to local precautions here at the Northern Kentucky Health Department, where officials are collecting information and meeting with local hospitals.
Well, right now, making sure that they have enough of the personal protective equipment on hand, that they have a protocol internally in terms of how they're going to deal with a patient, where they're going to put them at.
But Dr. Marchbein says she expects the cases to be sporadic in the U.S., mainly because there's strong health infrastructure here to care for and isolate anyone who falls ill.
I'm really not worried about a major outbreak in the United States, but I think that we have an obligation to help the people of West Africa. This is tragic.
It's why she's ready and willing to go overseas.
Of course I'm nervous. How would I not be? It's a disease with a 50 to 70% mortality. It's highly contagious, but there are ways of mitigating that.
Dr. Marchbein stressed to me today that this disease is not as contagious as other diseases that we're more commonly exposed to. Reporting live tonight, Jackie Congedo, WLWT News 5.
All right, Jackie, thanks. The Ebola virus has been around for a while, first identified in the Congo back in 1976, but existed in small, occasional outbreaks until more recently.